Hey guys, welcome back to my channel. I am Dr. Amanda Shi. I'm an anesthesiologist and intensivist, and today I want to talk about the dark side of academic medicine. So one of the things that I talk a lot about on my channel is how much I actually really love my job, and that hasn't changed. I am now in my 5th year as an academic attending, and I would say that overall it's an excellent fit for the things I'm passionate about. It's an excellent fit for how I want to live my life, and overall I'm not planning on going anywhere anytime soon. But that being said, there is a balance. So in order for you to be able to figure out what kind of job or what kind of career would be a good fit for you, I think it's important for me to also highlight some of the downsides that exist in an academic medicine position. So starting from the top, I would say that the number one thing is promotion pressure. So interestingly, my position is not necessarily through a medical school. So even though Mass General is affiliated with Harvard Medical School, I'm not technically a faculty. I'm an instructor through Harvard Medical School, but I'm not promoted through Harvard in the same way that a lot of other institutions where the academic component or the university component actually owns the hospital. So because Harvard University doesn't own Mass General, Mass General is able to create its own set of criteria and its own kind of requirements or baseline things that need to be done in order to maintain your position. So all of that being said is that I don't necessarily have a requirement to be able to become a professor because of the setup of my job. Most jobs at an academic place require you to pursue promotions. That means professorship. That means going for assistant, associate, and then full professor. Now, this being said, many institutions have a clinical track, and a lot of work that's done on a clinical basis actually counts for promotions in a clinical track. And so as a result, it may not be that challenging to get to assistant, associate, and finally full professor from a clinical track or an education track compared to an institution like Harvard, where we are put through promotions similarly to Harvard full-time faculty, like as in the professors that are teaching classes there, which is a very different setup, because if you think about it, professors that are teaching classes don't have a full-time clinical load while they're trying to do either their research or be able to do their publication. So it's a different setup, and promotions is just different from a clinical track compared to a fully academic faculty track in a university. So that all being said, even though I don't have a required promotions deadline, so like being promoted within X number of years, there still is something to be said about the culture of an academic place that encourages you very strongly to get promoted. So that is something that I still feel. I still feel the pressures of the needing to do the academic papers and research and presentations to be able to get promoted in the professorship route. Even though it's not required, it's definitely a culture, and it's definitely something that exists around me, and there's definitely some pressures that I face when it comes to kind of the promotions process. But that all being said, for me it's not required, but I could see that being, if it were required, something that would be kind of stressful and frustrating. In fact, I would say that even though that's not my goal to be a professor, the promotions process is very frustrating and is very stressful already. So that all being said, that's one piece that I'd say is a pretty dark side of an academic medicine position. The second thing is all the non-clinical work. So that kind of falls under the promotions piece. So non-clinical work can mean things like setting up administrative things for committees or participating in various committees and being part of that. It can mean research, it can mean presentations, it can mean any of the other kind of work that's asked of you outside of just direct patient care. So there's a lot of other roles within our operating room that oversees and or kind of manages resources or has to be readily available or has to be able to think on their feet. That while that's on the clinical side, there's some work that needs to go into that outside of the typical clinical hours. So overall, I'd say the whole box of non-clinical work is pretty big. And the other piece of an academic medicine job is that the education piece is another big one. So one of the things that many people may not realize is that when I work with trainees, usually the night before, my trainees are reaching out to me to be able to do a pre-op and talk about patients. Now, when my trainee is earlier on, or they haven't done a case that we're about to do before, we really spend quite a bit of time on that call to be able to go over a patient's history, go over some of the things to expect for the case, go over some of the necessary items that have to be there, and then contingency plans if something unexpected were to occur with the case. We also go over different education topics, different papers that may be relevant to that particular case or that patient. And so a lot of work goes into that. Oftentimes earlier on in the year when I have 2 junior residents, it can be an hour each call. So if you think about it, if I did a full day in the operating room, 10 hours plus 2 more hours on the phone working with the residents, talking through their pre-op or their assessment of what they're going to do in their plan for the next day, that's quite a bit of time. So that's another piece of the non-clinical work that many people don't realize, especially in anesthesiology, that we have to do as well. The third thing that kind of falls under the education piece is working with trainees. Now, I personally find working with trainees to be a net benefit. I find that they remind me of what it's like to be bright-eyed and bushy-tailed. They remind me of the beginner's mind, and they stay very, very curious, and they ask really great questions. And also, a lot of the time, the residents actually keep me fresh when it comes to literature because they're learning about different papers or things that are published in their didactics or working with other attendings. And so I find that there's a net benefit when it comes to working with residents. But that being said, I would say that the flip side of that is when you're working with a new resident or you're working with a resident that hasn't done a particular type of case, there's additional stress that's involved with that, personally, I feel at least. And the other piece of it too is every resident is very different. And so trying to figure out communication styles between myself and the resident and being able to give feedback and also making sure that the patient gets the best possible care. Those are all of these items that I have to juggle and think about and balance throughout the day that makes it so that it can be a more stressful day than if I were just doing a case by myself, as an example. So that's another, I think, third kind of, it's a dark side. It could be seen as a negative. Personally, I find that overall it's a benefit and it's a positive for me, but it certainly can add more stress to the day. And then the fourth thing that I wanted to mention was that most academic positions offer a lower salary. So many academic positions require that you get your salary from research funding or other sources of funding. I would say that in general, as anesthesiologists, we are typically very well compensated at various positions. So our compensation is not that low, but if you look at it relative to what the market is offering in private practice or community hospitals near the academic center, you're looking at 30 to 40% difference sometimes. And so that's a pretty significant amount that could matter for individuals, depending on kind of what stage of life you're in, or depending on like how many loans you have and how concerned you are about being able to pay those back versus doing like public loan forgiveness, et cetera, et cetera. So definitely one of the things about academic medicine is your pay is going to be a bit lower. The flip side of that is most of the time, the reason your pay is a bit lower is because of the fact that you get more flexibility. So in my job, I would say that I have more non-clinical time. That means I have more flexibility in my weekly schedule. And that allows me to be able to pursue those other things I'm really passionate about, such as this channel or the virtual pre-op call I do with medical students in the summer, or my work with the American Medical Women's Association, or now I would say that a big piece of my time is spent doing the work that's related to my pre-op director position that I have as well. So for me, I like the flexibility. I'd rather have flexibility and have the option to pick up work. So if I wanted to make more money, I can pick work up, compared to being stuck in a kind of more 5 days a week and working a more steady schedule in order to get more pay. So for me, flexibility is key. That's why I wanted to stay in it. And I don't consider the pay to be that dark of a side of medicine, but I could see that being a disadvantage of academic medicine. So those are the 4 things that I would say are some of the downsides of pursuing an academic medical career. But ultimately, there are definitely positions that you can make work for what you need, or you can decide that academic medicine isn't necessarily the right path for you. Right now, the anesthesiology, like as of 2024, the anesthesiology market is so hot that many of my residents are not even pursuing fellowships anymore because getting a job makes the most sense to them. So ultimately, you have to decide what matters to you. You have to decide what your priorities are and what stage of life you're in and whether this is a good fit or not for you. So there's not a right answer per se. There's just a right answer for you at that moment in time. And you never know what opportunities will arise along the way when you're looking for your jobs or, in the future. And so that all being said, I love my job. Even though there are some dark sides or some negatives to it, I would say that those negatives certainly do not outweigh the positives of the position that I'm in. So consider academic medicine if you are a student or a trainee that's starting this process, or you're looking towards another position. If some of these things don't really bother you as much as they may bother other people. Okay, well, thank you so much for watching this video. Give me a thumbs up if you liked it. Subscribe to my channel if you want to get updates from future videos from me. And also give me some ideas on things you want to hear about, either in the comments or send me an email. I will see you guys next time.